Hi, it's your host, Sydney Rafe. Welcome back to another episode of Metabolism Diaries, the podcast where we chat all things GLP-1s. And today we have a doctor on the show. Welcome, Dr. Matej Rentia. We're going to talk about what GLP-1s actually do to your body and much, much more. So let's get into it. You are my first doctor that I've had on the show. And so we need your information. I've had many people on so far who've been on GLP-1s and on the journey. Can you tell everyone a little bit about your background?
Yeah, thank you so much for having me on. So I'm Dr. Matej Rentia. I'm double board certified in internal medicine and obesity medicine. The internal medicine part, think 18 and over. So just adult medicine. And I own and operate the Rentia Metabolic Clinic. I see patients in Indiana and Illinois. And I've been practicing medicine for over 10 years now. Time really flies. Initially, I started out in primary care, and then I really saw that we were never getting to what was actually causing the problem. So I would be sitting there treating hypertension and diabetes and things like that. But I was so frustrated that we didn't have the time in the visits, and my schedule was booked like 6 months out. I couldn't ever do what I really needed to do with people. And so I started my own clinic to be able to really kind of get deeper into what is actually causing this insulin resistance, right? How can we actually treat it? Get more into the genetics, things like that. So that's what I'm really passionate about, is really what we call like full, complete obesity care, and not just like here's a medication, but really what are some things that are actually causing it.
Yeah. And I know you have on your social media bio that helping you work with your biology, not against it. And I feel like that's really important. And I'm so excited to have our conversation for multiple reasons, but also because, GLP-1s, I know they've been around for a while, but it's super overwhelming to understand what are they doing to your body, where do you start, and how do you do it best. So can you explain in simple, like kind of just for people who just don't know, when you decide to take a GLP-1, what is it actually doing to your body?
So I guess just there's many things that it does. So one of the things that we realize is that everyone's focused on GLP-1 receptors in the gut, but we actually have them in many places in our body. So I'll give like one or two examples, but what we're finding out is that it's affecting different things. So the one thing which is quite obvious and evident is that it's helping with your blood sugar management. So if you don't have a problem, it will not affect it. But if you do, a lot of people have pre-diabetes or different forms of insulin resistance, and the blood sugars will be up. So it's helping with that. It's helping with it's going to centrally to the brain to control the appetite center. And so a lot of people are thinking, oh, well, you can't eat as much because the stuff's not moving along in the stomach. That's one aspect of it, but you could still be wanting that stuff all day long. So it's going into the hypothalamus. Not a lot of other medications that we've given are able to get in central like that. That's why it's really important that you have medication that is reputable, because these things are reaching parts in our body. It's not just like staying external on the skin. I mean, we know skin things get absorbed, but it matters. Now, some of the other things that we're seeing from like a cardiac standpoint is that it will increase something in the body called, it acts like atrial natriuretic peptide. And that,
Okay.
think about it being like a diuretic in your body. So there's that aspect. It's helping a lot with the cardiovascular lining. So when we have blood vessels where the blood is going through, it helps the lining of that. And that's really important, because that's where like plaque and heart disease, stuff like that happens. So there's a lot of different things, but hopefully that just shows that this is
Yeah.
about actually treating a metabolic disease, right? It's not just like, oh, you're going to eat less. That's like really not the whole story.
And so okay, so how does it actually help you lose weight? So I know you're eating less, you're slowing down your digestion. Because I've heard from many people who are on it, it's like we've tried diets before. Of course, it's hard to stick to a diet, but they've eaten less and it hasn't really helped them, lose weight. Why is this medication different when you take it?
So when you're losing weight, the body fights back. So let's say before you did a calorie restricted diet, and the classic place we see people get into trouble when they're just doing lifestyle. So that's just changing how they're eating and how they're moving and maybe sleep, all the controllables, right?
Yeah.
When they're doing that, after about 10%, hunger hormone starts to go up, metabolism starts to go down. So literally, I did an episode on this. It's quite shocking. Within 6 weeks, it's down 20 something percent. And within 12 weeks, it's like 36% down.
Wow.
So the point is, within a few months, you are not like literally within 3, 4 months, you're not in a great spot. So the reason I say this, it's that you think, well, I'm eating this lower calorie number, but already within 3 to 6 months, your metabolism way took a dive compared to where you thought you had to eat. with the online calculators, the basal metabolic rate. So you're having this uphill battle. The hunger is fighting you. There's really only so long that people can be physically hungry and not eat, and we are not trying to create disordered eating. And
Yeah.
ghrelin levels go up. That says, you're hungry, start eating. You now start to, because you've lost some weight, you now have less leptin potentially, and leptin is the one that says you're satisfied, you've had enough. So everything is fighting you. These medications are directly helping you with a lot of those things. The
Okay.
other thing being, a lot of I'm really about saying that it's not about calories, it's about composition and the quality of the food you're eating.
Mm,
When you're not using these medications, many people, part of the disease of obesity is you crave these things. Like your brain is wanting things that other people don't. We see this with brain imaging studies. They'll show a brownie to someone that doesn't have the disease, nothing lights up. They show it to someone like me who has the disease, and it's like, wow, I want that, right? And it's like lights up. And this is like on imaging, okay? This is not just someone saying that they like a brownie. So we are helping with so many different aspects. A lot of the time with the food aspect, people want different foods. Like I know for me, I'm like, I want that apple. I want those things. And that was not me before it was kids, right?
that's so going to resonate with people, what you just said, especially about the brownies, because we all, like people who struggle with this disease, look at their friends who just maybe have a bite or can have one cookie. And it's like, why not me? Why can't I control that? And so that is a really helpful analogy. And then you said one thing also earlier that I just want to touch on. You said it's really important that you get this drug from a reputable brand. Now, on social media, there's so many people like, because it's still so expensive. I'm hoping, and I know they're cutting costs as, each few months, but where can we get it that is reputable? Because you see a coupon, you see a code, and it's so expensive that you want to go for that, but it's scary
Yeah.
because you're injecting this drug in you. So what do you recommend?
I mean, the party line from us that are actually board certified is going to be to get name brand. The only reason being is that we hope that the facilities are up to spec, although we're seeing that some of that is not true either, right? Depending on, we won't mention specifics here, but the point is that they've gone through FDA testing. So we know that if someone takes that medication for however many years, that we would know, we would have a signal detected if there was an increased cancer rate or something occurred. One of the problem with the compounding pharmacies, and I'm not even against compounding, it's that we don't know 100% what's in them. And let's say that you take that for a lot of years on end, you don't know if you're going to get another health consequence because it had like an impurity or it was made a little different because that version was not studied. So that's one of the main things I want to bring up is that it's about long-term safety because we know that you need to be on these potentially for years on end, right? And so it really, the quality matters. So I would love name brand if you can't afford it, which I know is not an option. Okay, so then the secondary thing would be I think you really need to work with a medical professional, whether it be a physician that you're working with, a nurse practitioner, whoever it is, and they need to vet the pharmacy. So these pharmacies, they are looked at by the board of pharmacy. Nothing should be research grade, right? There are different certifications, if you would, how it's classified. And so you need to work with a medical person to do that. And I can't sit here and be like, oh, only this or that pharmacy. I know that in my clinic, I have one that I work with, but I can't like say that on here because then people would think that that's the only good one. And I'm sure that there's more that I don't know about because I'm only thinking about Indiana, Illinois when I'm thinking about the medication.
That makes sense. And let's say someone, is watching this podcast and they haven't decided to take a GLP-1 yet, but they're curious. Do you recommend they start with their primary care doctor? Do they start by finding one of those online hubs for GLP-1s or who's qualified to really prescribe this, or what should you look out for?
The main thing that I care about, because there are amazing I'm a telehealth company. There are amazing telehealth clinics, right? I
Yeah.
meet with my patients in the beginning weekly and then monthly, and we're doing body composition, all the rest. So the key here is whoever is going to write this for you, are they able to do follow up with you? So obesity as a disease in the beginning, if you're looking at like the endocrine society guidelines, things like that, you need a lot of follow up in the beginning, maybe weekly, monthly. Like there's a lot within those first, let's just say 3 months. There's this sort of like golden zone right in there. So if you are getting your meds from somewhere and they write it and then you never again talk to someone, so there's no face to face, no one's asking you pointed questions, like they are coming up with the questions, not just like, here's a little, report to me if there's a problem, because you don't even know what's a problem or not when you're starting the medication. So the main thing is, are they going to do follow up with you? And then I really think that you should be seeing someone that is running lab work, that is doing what we call a body composition test, meaning how many pounds of fat and skeletal muscle are there? see where the distribution on your body is, because not just a weight, it's about where is it located on your body and how is it distributed and is it visceral or is it not? So these things are going to determine if you're actually healthy or not. And it's not just a number on the scales. The person you're working with, is there enough follow up? And then are they able to actually get down to, I always say, the roots of what's happening? So the lab work, the body composition, genetics, maybe they run some genetics
Yeah.
reports with you, right? Can they do that? And so I think that's easy to vet these people. And literally from the get go, you ask, does this person or this team, whoever you're going to join, do they do these things? And it will become very evident if they do or don't.
Okay, great. That was really helpful. And can you explain a little bit? You just talked about genetics. Can you speak a little bit about obesity and genetics?
Yeah. So there are some rare forms of obesity occur. We will already see it in the pediatric space, like before age 5. So these are rare conditions. They're typically picked up because the signal is there so early. This person's really struggling just from a very early age. They'll typically be seeing the pediatrician and they'll send them to endocrinology. So those cases get caught, but not everybody is as pronounced. So the one that I just talked about with pediatrics, some of them can be monogenic. So meaning it's one gene. That's incredibly rare. Most obesity, it's multiple genes that's causing it. So when you do this testing, you might qualify for a different medication out there, but you didn't know it. So I
Yeah.
had a few years ago a patient that was in their 30s, and I caught one of those diseases that as a kid they should have caught. And that was because we ran the genetics testing on them. And this is actually free if you're someone that struggled with weight as a child and if your BMI is over 40, it's uncoveringraregenetics.com. So if you meet that qualification and they'll say, "Hey, did you have this as a kid? Or did it start before whatever age? Is your BMI currently above whatever?" So that's to find those really rare cases. And then there are other genetics tests that let you know, like other tests that I run where it lets you know, do you hyper respond to stress? So do you make more cortisol at different times when you're stressed out? Does the signal stay on longer? You can do different testing to find out about caffeine sensitivity, all these kind of things. And then you can help change what you're doing based on evidence and not just like random things that you're changing. You can make it
Yeah.
more targeted, is the word I would use.
Okay. And, I know a lot of moms out there are on GLP-1s, and so I feel like they'll also be curious about this. But as someone who my dad has always struggled with his weight, he was obese his whole life until, taking in GLP-1. And so me and two of my other siblings, and we all struggled with our weight when we were young, and some of us more than others. What does that kind of look like when, you are 5 and you are, your kid is obese? What does an endocrinologist really do? And should parents seek that out for their children?
I think it's always helpful to seek out treatment. I think one of the tricky things that I struggle with is that every doctor has a different philosophy. And so I really don't want people to go into and it's just like hard to say, like, I don't want them to go into a scenario where then the kid gets disordered eating because from such an early age that the wrong message was coming. Now, I think what we've really been changing over the past few years is the way in which we approach the conversation. So it's not really that we say, oh, we want you to lose weight. It's really we want to build healthy habits. And so I think endocrinology is helpful because in the pediatric space, it's really about what's happening at a family level. So it's like organizationally, you can't
Yeah.
kind of, right, you can't come at the kid. And I know I grew up with this because we didn't know better back in the day, right? My
Yeah.
parents are physicians, right? Like all the things. And it was like, do you really need that second portion? Or, you don't need that brownie, right? Like very much so just focusing on two of us struggled and two of us didn't. So there were 4 girls and it was
Yeah.
like, coming at me. And again, they loved me. They meant the best, but it's not helpful. And so I think by going to a physician that specializes in this, they're very good at helping the parents with, do not target your child, do not talk about weight. Here are things that are actually helpful. And so I
Yeah.
think if
That
you
makes
see
sense.
an endocrinologist, I know one of my friends, she does a lot of this here at Indiana University, and she's a pediatric endocrinologist. And there's a way to have these conversations where kids start to hear this in a way that is helpful and not going to hurt them. But that's a delicate conversation. So yes, I do think that they should get the help early on.
Yeah. It is such a hard thing.
Something that I think we have to learn, I had to learn this like consciously a few years ago when I started to work in this space. With weight, everyone's policing everyone else, right? Like you think you have the answers. And so you're like making comments on them and them. And something that I really had to learn is I'm only going to help the people that are actively seeking me out, but otherwise it is not mine to judge. how you look, what you eat, what you do. You might be doing the best that you can. And who am I to say if what I think is best or not for you? And so I really think that we just have not learned that as a society yet, that it's not our place to intervene in that capacity in other people's lives because it was very normalized before to sort of
Yeah.
shame people. Right? Like, have you seen the clip where this is like they're in a support group, it's like in the 60s, and
Yeah.
the doctor's like, "Yeah, they're like he's like actively shaming the people in the group. Like, you shouldn't eat as much, like making it a them problem, right? So we've kind of like seen that modeled all these years, and
Yeah.
now we need to relearn that physiologic factors are driving a lot of this. Sure, there can be history of trauma and other things, but a lot of this, no one's picking to have this as a struggle. This is
Yeah.
a biological thing that's occurring. And so if we come from that angle, we stop policing people because they're not picking it.
That is really important. And you saying no one picks to have this as a struggle. And I just want you to speak a little bit to this because I think that there is so much shame around still around GLP-1s. And I'm starting this podcast to, of course, hopefully erase that and make people understand because I hear clips online that, it is not, you want to just eat less. Like people are like, who don't understand the struggle or like, you should just eat less. As someone who works out, as someone who tries to always eat healthy, I've always not been as fit as my friends who do the same. And that's when I realize it's a genetic issue and something a little bit different. But can you talk a little bit to that person who is like, well, I want to just eat less. I try every day is, the diet, that I'm trying to start or whatnot.
If I could bring you into seeing the studies and the biology behind it, you would not ever again think that about yourself. So I just want to say that your body physiologically is responding differently. So I always describe it as there's like a hurricane going on. And I say, like, think like literally over 100-mile-hour winds, right? Like just horrendous flooding. And I'm like, just go, we're in this building, just go across the street to the drugstore and go ahead and just like get me a bottle of water and come back as though it's no big deal. It's like, no, I'm putting you in peril as you go
Yeah.
through that, right? So it's the same
Yeah.
thing. It's like you might lose weight and then you regain it and you actually get sicker, right? Because you're trying to do the right thing. But when you regain that weight, you put on more visceral fat. So you get sicker. So you're not just back at the same weight, you are sicker that next time. And then you've also probably lost muscle. So your metabolism is down and the cycle repeats and repeats. So, what I want to say to the person that is out there struggling and you keep internalizing it, I guess I want to know, do you judge the person who gets thyroid medication? Do you judge the person who has blood pressure up? Do you judge the person that struggles with cancer, anything else? No, because you're like, oh my gosh, they need that, of course. So, why is this any different if there's a tool that helps you to manage this? It's not even treating it, it's managing it. You still have to work so hard on nutrition and all the rest of it, right? I would just question, can I give myself that same opportunity that I would to other people? Why am I going to make it different for myself? And so just realizing that there's a lot of physiology that's fighting you. Again, you're not wanting that to happen.
That makes so much sense. And thank you for saying that. I think that will resonate with a lot of people. Now I want to learn from a doctor, what is it like to take this drug and optimize your health? And I know that's a big question. So maybe we can start with how should your lifestyle change? What are 3 ways that you can start changing your lifestyle when you take this drug to
Yeah,
optimize?
this is such a good question because I love the word optimize because it implies get to the best place you can get to because it's going
Yeah.
to look different for all of us. So we can't have weight be the end point because number one, weight does not equal health. It could be different distribution and hormones and blood sugar and the rest of what's happening. So the first thing that I would say to optimize your health would be by far, I think one of the most important things, well, two, it's going to be nutrition and movement. So from a nutrition standpoint, I would look at, can we get as much as possible whole-based foods because the processed food, we don't have an off signal and our hormones don't respond normally to it. So let's say you have a cookie. I'm not villainizing the cookie. The problem is that you're going to want more and more of it because our brain is designed, designed to be highly addictive, have a bliss point, like you want more and more of it. You're able to get a lot more of those foods in. And if you, let's say, had been eating a bowl of fruit, you'd be full at some point. Like there's a time when it turns off, right? So I would look to whole-based food because your hormones work the best, your signaling is working the best, and it's not fighting you. And a lot of people, some people have up to 70% processed foods. This is a tall order, right? It's also a place of privilege to be able to just eat whole-based food. So one thing I would say, no matter what your scenario, what's one step closer that we can get to that, even if it's canned vegetables, even if it's anything like that, can we first eat some protein and fiber before you have the processed food? So, any way in which we can decrease the burden of the processed food hitting you so quickly and your insulin going up and your blood sugar going up, that long term is going to help your heart health and everything else. Like, we're seeing what's happening in the gut, right? Like, all that kind of stuff. So, number one, nutrition. Can you do whole based food? Can we decrease processed food? And a lot of the processed food is going to be decreasing added sugar. So, one way I like to work with people is, let's say you still want to have chocolate. I'm talking about the Sour Patch Kid. You still want to have that. It's like, hey, can we keep added sugar? Now, that's not carbohydrate. Added sugar is like straight sugar that's added to something. When you look on a nutrition label under carbohydrates, one of the line is added sugar. Can we
Okay.
keep that 40 grams a day? You could still be having like a ton of apples and beans and all these amazing things that have carbohydrates in them, but they've got fiber with them as well. They've got hydration. It's so different compared to having the processed stuff. So my whole thing is like, delay, don't deny. First, eat the things you need, then you eat the stuff you want. And then also, can we just slowly move toward a world where we're helping support more your hormones, your gut microbiome, all of that kind of stuff? So nutrition, if you work on nothing else, it's like nutrition, I would start on that. Number two would be movement. And the reason I say this, it's that movement, I don't want you to think about weight loss. So, like, let's say that they did a study where people looked at it for weight loss and they exercised an hour a day, 5 days a week. So, think 5 hours of exercise, that's a lot. And they lost 3% body weight in the year. Okay. So, the reason I'm laughing is like, that's a lot of effort for like not a lot
Yeah.
of return. Right. So, I want you to think about exercise for heart health. I want, your VO2 max. I want that to be in a great spot. I want you to think about it for stress management. We all have stress. The way our modern world is built, there's too much noise going on, too much is expected of us. You have to empty the stress bucket daily. That is part of it. I care about it from an insulin resistance standpoint. The more muscle you have, I think about it as like an insulin resistance fighter. So we want that. Right? I care about your metabolism. I care about your bone health. If you're not exercising, really hard to have good bone health, right? I think about, and I think I mentioned cardiovascular. So I think about a lot of things, the last being weight loss, but I don't see people reach optimal health without some exercise. And it can just be like 10-minute strength training 3 times a week and maybe a 30-minute walk per day. It does not need to take over your whole life, but you're going to have to make room for it. If you want health, you are going to have to make room for this. So if you're telling me, I don't have that time, you're either going to have the time or life's going to make you have the time. Okay. Like an illness is going to enter the picture. And so I'm really always saying, can we carve this out? Maybe you're answering emails and you have a walking desk, right? Like you're walking as you're doing these things, or you're doing a meeting and you're doing it on the phone and you're taking a walk. Like, can we pair things? I don't know. I don't care, but we need to get that in. So those are the two
Love
main
that you
things.
said that because a lot of people think like, oh my God, I have to make this change. It's going to like, now I have to wake up, blah, blah, blah. It doesn't need to take over your life. That's very,
Totally.
very helpful.
The main thing that I probably should have started with would be sleep, because
Okay.
I always tell people, like, if we think about a health pyramid, it's like, what's at the top, right? Like, what do you need to do before you can get to anything else? Or what would be the base of it? Like, it would hold everything. It would be sleep, because if you do not have if you're not rested, let's just put it that way, everyone's amount's going to be different, right?
Yeah.
But if you're not rested, your hunger hormone levels are up to 15% during the day. That's a lot,
That is a
right?
lot. Yeah.
The emotion centers of your brain are overactive, so you're making more impulsive decision with food. I could go on and on. Honestly, if your sleep is not where you want it to be, I would first be working on that before anything else. Do you need a sleep apnea test? Like, what else do you need? But let's treat that first before we start having you make hard decisions with meal prepping and doing movement you've never done. It's like, we can't put more stress on the body unless you are able to get rid of some stress by sleeping, right? So
Makes sense.
that's the main stuff that I would say, and there's always more, but that's the main stuff.
And now I know you spoke about nutrition, but I need you to just answer this one question because I think that so many people are taking GLP-1s, getting less hungry, and so they'll have pizza, like just one slice of pizza for lunch and that's it. Or they'll have a croissant and just a bit of a croissant and not eat anything else. So can you explain why it's important to also, as we were talking about, optimize your nutrition in a full, complete way rather than just a little bit of the carbs and
Yeah.
nothing else?
So one thing is, well, two things. We want to get enough protein so we can support your muscle mass. Protein is also going to help you to not get hungry again real quick, because let's say you have, by the way, like, yay that you can eat less pizza, right? Like, amazing. But You might get hungry quicker. You're not satisfied. So then you again end up going for something else that maybe doesn't serve you well. So we want enough protein for that reason. Fiber, we many things I think about with fiber, but one of them being it's colon cancer prevention. So we're seeing this epidemic where many people are getting colon cancer in their 40s, and we're seeing this massive relationship to a processed food and colon cancer. And it's like the brush in the colon that's brushing stuff out. So that's one aspect, but the other one is we have billions of bacteria in the gut, and this is called the gut microbiome. So there's more of us than human cells.
Yeah.
So just to give you a respect level on this. And what we see is that we don't know if it's that one causes the other, kind of how it occurs, but the more sick you are, the more gut microbiome is sick. So the ratios
Okay.
are off. So one thing when you're eating whole-based foods and getting the type of foods in that you need that have fiber and things like that, your ratios return to normal, you get healthier. And I want to give a very practical reason why this matters. They did a study and they looked at people got diagnosed with melanoma, and those that 2 months prior had more whole-based foods and their gut microbiome had a better distribution, they lived longer. So this is literally helping you so that if an illness comes in the future, you have a better chance of surviving it. So not
Mm.
only do you feel better, your energy is better, you maintain your muscle, you're not going to get as many illnesses, or if you do, God forbid, you can recover from them. It's not just about calories. What you're getting needs to actually serve you properly. So I don't care if people have a one-off meal where they're just having a croissant. Okay, fine. It's Sunday morning, you went to brunch, whatever. But routinely, can we figure out combinations like maybe a Greek yogurt with some chia seed in it, maybe a little bit of kefir for the gut microbiome, berries in there are super high fiber. Those meals are not very voluminous, like the volume's not too high,
Yes.
but you're going to get what you need. And so can we just create a few meals that really help you out that are easy that you can put into the rotation?
Thank you. And you also spoke a little bit about, colon cancer and the importance of fiber. And now that leads me to another question. I know that GLP-1s slow down your digestion and you're not going to the bathroom as regularly and having bowel movements. And a lot of people deal with constipation. How do you combat that when you're on a GLP-1? What do you tell your patients?
Number one, I have to say, because I'm a physician, please talk to your doctor because again, I worry about things like colon cancer and other things or untreated hypothyroid, right? So you need to get your labs checked and you need to make sure to talk with the doctor that there's no what we call like red flag symptoms like belly pain, blood in the stool, things like that. So there's that aspect. But what I generally look at are these few areas. Number one, are you hydrated? If there's not enough hydration, you're going to be constipated. So that is one area. Number two, is there enough fiber? So the general guidelines are for women at least 25 grams or more, for men 38 grams or more. And so most people, this is where the problem is. I want to say like
Sure.
95% of people that are coming in my clinic, I have them do a few day nutrition audit, majority 15 grams or less. Most of them, honestly, up to 10 is what they're getting. And this is normal because processed food, it's not in there. The fiber doesn't taste great. Fiber doesn't sit on the shelf well if it's normal and hydrated. So this makes
Yeah.
sense. So, all right, so you got the water, you got the fiber. The third thing, movement. If you're not moving, the gut has a hard time moving along. And the classic example I always think of is when I was in training, it was all inpatient, right? Majority of it. And you would have the patient that had sat there for a few days. And one of the first things that would happen is they'd be super constipated. The nurse would call you, hey, can you put in something for a constipation? So
Yeah.
moving, and also from a gas standpoint, right? Some people talk about, I feel so bloated, I feel this, I feel that. Have you moved? Have you been walking? Have you been doing stretching? Like what have you been doing, right? So that's the third thing. All right, the fourth thing that I think about is sometimes that's just not enough. They're getting all the fiber, they're hydrating, they're moving, and they're still having trouble. Then I look at what supplements or over-the-counter things can be used. It's really endless. Miralax is something that can soften it, but Miralax mushes, it doesn't push. It's not a stimulant. So magnesium can both mush it and can be a little bit more of a stimulant effect, right? Like kind of move stuff along. And there's so many different kinds of magnesium. So it's really, if you tried one product, you tried one product. I would go ahead and try some others because some of them have up to 7 kinds in it. Some of them have only one. You got to
Yeah.
find the one that actually works for you. You have to titrate it appropriately every so many days. And so I think about stuff like that. And I'm a big fan of, there's an aloe supplement that I like that works really well. I think there's a lot of additional stuff that people aren't using, but typically I don't want to have to rely so much on supplements. I want to try to solve it in other ways if we can.
That makes sense. And I want you to speak a little bit about like a GLP-1 starter pack when it comes to supplements. When you start this type of medication, how do you make sure that you proactively take the right supplements to optimize your health long term?
Yeah, this is another one of those questions where it's like, I really think supplements need to be customized. I will say the one exception here, which is a multivitamin. And every patient that comes in, I say, hey, are you on a multivitamin? And the reason being that when people are working on fat loss, they tend to do things that create deficiencies. So they'll like cut out egg yolks, which have all the B vitamins in it, right? Or they'll start to do things where they get problems. So I think a good quality multivitamin, I think that's the most important. But then beyond that, as far as do you take more stuff that leads toward hair supplementation and stuff like that, that's really customized. And I would say talk to your team with that because too many people are doing the shotgun approach where they're like, I'm taking ashwagandha, I'm taking, whatever. They're just taking all this random stuff. And you maybe were someone you didn't ever have an adrenal problem. You didn't ever need the ashwagandha, right? Like you don't actually know what's going on. And so it ends up being not the most helpful. So I would say multivitamin would be the main thing that I would look at.
That's helpful. And how do you respond to hair loss? Because I heard it's not actually from the drug, but how, when you decide you want to take this drug and you're very afraid because you don't want to lose your hair, what should you do?
Yeah. So when you lose a significant amount of weight, or really it can be whatever amount that your body perceives, it's very stressful. So I want you to imagine you losing weight, your body thinks it's in starvation. It says, hey, this is not good what's happening. Conserve energy, right? That's why the metabolism goes down. Hair is maybe not essential, right? We want the heart to keep working, but hair is a second thought, right? So the hair works in these different cycles. So think like 3 months growing, 3 months staying where it is, 3 months falling out. So there's these different cycles. And what ends up happening is usually about 6 into weight loss, people are like, "Oh my god, I'm getting hair loss." It's like, yeah, when the stress started to occur, you started to have this problem, but you didn't notice it until later, and then it takes almost a year for it to come back. So that's from the time of the stress being removed. And this stressor, by the way, can be anything. Work stress is up, you lose a loved one, you're in the hospital, you get sick in other capacities, but weight loss is a huge one. And we call it collagen effluvium, and we can't prevent that. So most people are going to go through that. That being said, you should talk to your doctor because we want to make sure that the thyroid's okay, that there's not an iron deficiency. I would actually work with your physician because
Okay.
the other thing too, a lot of people that are experiencing this, they might be in perimenopause or menopause, like for women, they might
Yeah.
have other patterns coming in, like female pattern of hair loss that's popping in, and it's not the same treatment. And so you want to make sure, like I actually just went to the dermatologist and she takes a little microscope thing or whatever, magnifying glass, and she was able to see the hair follicle size in the front versus the back. And this was just like really fascinating hearing her thoughts, the labs that are checked. It's not simple necessarily, and you don't want to miss something. And so I'm like, you should work with your doctor and not just be like doing home remedies.
Yeah, that's really important. And the last question that I have for you that I'd love for you to speak on is so you're taking this GLP-1, and as you were saying, it might slow down your metabolism. You're maybe losing some muscle. Of course, it's important to, lift weights and eat protein to keep that up. But a fear, I think, is, of course, I think you need to you spoke to earlier that this is a long term medication. But let's say you plan on getting pregnant or you have to go off. I think a lot of people, because we've seen articles and all of this, and I'd love your answer, is we're afraid that we're going to take this drug, lose weight, and then gain even more and more back. So how do you think about that as like a patient?
Well, the one thing I want to say is it's not a given to lose your muscle. Majority of my patients in the clinic are either losing no muscle, that's majority of them. And then if they're losing muscle, I want it to be under 10%, but they're not losing 25, 35% that you're seeing in the studies. You have to keep in mind with the studies, they're not doing close nutritional observation with them. They're giving them some general thoughts. But the point is, number one, you don't need to lose all that muscle. So that's number one. Number two, this is very common what you're saying, that there might be reasons you have to come off, let's say a sub-Q injection because of price or a pregnancy, things like that. And
Yeah.
so if you maintained your muscle to begin with, then I would work with your medical team and I would see, is there an oral generic option of something that can help me maintain where I'm at? So that would be one option. The thing I want to caution people is that people say, well, I have the habits in place now, so I'm going to be able to do it. You had medication assistance that was controlling the physiology to help you to be able to do that. The minute you remove the medication, hunger is going to go up, urges and cravings are back. And again, same scenario. That's most people that their whole lives have struggled. Well, like let's say like long term, like more than a few years have struggled with it. That's going to be their reality. So if you're heading into this, number one, the whole time, please care about your muscle. You need to do some strength training. I don't care if it's just a few squats, a wall push up. If you're in a wheelchair and you can't move, there are chair exercises that you can do. These things do exist. They can be just as effective, but you do need to care about this stuff. You can't just not be eating protein, not doing strength training and think you're going to pop out the other side being a lower weight and it's all okay. It's your health might have actually gone downhill. So we need
Yeah.
to care about it throughout, and then don't just stop the medication. Talk to your team and see is there something you can transition to. I
Mm,
think it was really encouraging recently here in oral GLP-1, they were showing that it could keep off the weight that people had lost with the sub-Q injection. So I think that's actually, I was like, that's a good study. I'm glad you did that because that's the
yeah.
data we needed. Yeah,
Yeah, definitely. This drug helps the emotions behind
yeah,
emotional eating,
yeah.
but it's not solving the root issue. And so a lot of people say, well, like this isn't going to solve your problem. You still have it.
Yes. But here's the thing that it does. It leaves you enough mental space to be able to start to get to the bottom of it. I will tell
That,
you what I see month one, and I talk about this a lot. And this can be like, why is an obesity medicine doctor talking about this? But month one, you get on the meds, suddenly the food noise goes down. A lot of people, if you're an emotional eater, I know this was me, I was sad that I couldn't have the food to feel better. Like I wanted to want the brownie. I wanted to eat the brownie to feel better, because you're so used to that. And
yeah.
food actually, you do feel amazing the minute you eat it, right? So it's actually like a smart thing when people learn to do that with food. But when that space is cleared up, that you're not constantly thinking about food, what I help people do is they have to build out hobbies. You have to build out other interests. Maybe you start to actually get into therapy. Actually, I recommend all of the above, to be honest. And all that work needs to be done together. I do a lot of that in conjunction in my clinic, but I don't think that people think about the hobbies and other things. I know I've gotten into coloring, painting, crafting, and I did some of this in the past, but it wasn't like all day Saturday. And so, because it's like we're not going to be sitting there eating on the couch. And so this is something else to do, right?
It makes so much sense. Yeah, I remember, yeah, the first time I went to a Chinese restaurant and I was on the drug, I cried because I was like, I don't feel like, and was like my favorite thing to do. So, your hunger does come back. But that really resonated. It has been so helpful, and thank you so much. I think all of this really spoke to a lot of things that patients and I have concerns about. Hearing it from you and your analogies were so in patient terms that we can all understand. So thank you.
Awesome. Thanks so much. If anyone wants to find out more about my clinic or
Yeah,
podcast, anything like that, the best place to go is rentiaclinic.com, RENTEA in the word clinic, all one phrase.com. And there's a link to my podcast and different resources that can be really helpful.
amazing. Well, thank you guys so much for listening to today's episode of Metabolism Diaries. If you liked it, go ahead and give it a thumbs up and make sure you're subscribing. Also, share it with a friend or family member who might also like this episode. I know I'm going to go ahead and share it with my dad as soon as I post it. And if you'd like to follow me on TikTok or Instagram, my handle is at Metabolism Diaries. Come say hey in the DMs. I can't wait to meet you, and I'll see you all next time.